Must know mental health sleep disorder practice explained. Question 1. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A, sertraline. Option B, lithium. Option C, clozapine. Option D, haloperidol. The correct answer is option B, lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 2. During a panic attack, what is the nurse's priority intervention for a patient with panic disorder? Option A, encourage the patient to verbalize their feelings. Option B, provide reassurance and stay with the patient. Option C, leave the patient alone to calm down. Option D, distract the patient with a task. The correct answer is option B, provide reassurance and stay with the patient. During a panic attack, the priority intervention for the nurse is to provide reassurance and stay with the patient. This action helps reduce fear and provides a sense of safety, which can aid in calming the patient. Question 3. In the treatment of generalized anxiety disorder, GAD, what medication is frequently prescribed as a first-line treatment? Option A, clonazepam. Option B, buspirone. Option C, propranolol. Option D, hydroxyzine. The correct answer is option B, buspirone. Buspirone is often chosen as a first-line treatment for generalized anxiety disorder GAD due to its efficacy and favorable side effect profile. Unlike benzodiazepines such as clonazepam A, buspirone does not. Question 4. During a treatment team meeting, the point is made that a client with schizophrenia has recovered from the acute psychosis but continues to demonstrate apathy, volition, and blunted affect. The nurse who relates these symptoms to serotonin excess will suggest that the client receive Option A, chlorpromazine. Option B, phenelzyne. Option C, haloperidol. Option D, olanzapine. The correct answer is option D, olanzapine. In this scenario, the symptoms of apathy, volition, and blunted affect are indicative of negative symptoms commonly seen in schizophrenia. These symptoms are often associated with dopamine and serotonin imbalances. Question 5. How do epidemiological studies contribute to improvements in care for individuals with mental disorders? Option A, providing information about effective nursing techniques. Option B, identifying risk factors that contribute to the development of a disorder. Option C, identifying individuals in the general population who will develop a specific disorder. Option D, identifying which individuals will respond favorably to a specific treatment. The correct answer is option B, identifying risk factors that contribute to the development of a disorder. Epidemiological studies play a crucial role in identifying risk factors associated with the development of mental disorders. By pinpointing these risk factors, healthcare providers can implement preventive measures. Question 6. Child Protective Services have removed 10-year-old Christopher from his parents' home due to neglect. Christopher reveals to the nurse that he considers the woman next door his nice mom, that he loves school, and gets above-average grades. The strongest explanation of this response is Option A, temperament. Option B, genetic factors. Option C, resilience. Option D, paradoxical effects of neglect. The correct answer is option C, resilience. Christopher's positive outlook, strong school performance, and forming a bond with the neighbor indicate resilience. Resilience refers to the ability to adapt and thrive despite facing adversity, such as being. Question 7. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder (ADHD? Option A, haloperidol. Option B, sertraline. Option C, methylphenidate. Option D, clozapine. The correct answer is option C, methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 8. During a manic episode, which nursing intervention is most appropriate? Option A, encourage group activities to increase socialization. Option B, provide a structured environment with limited stimuli. Option C, allow the patient to engage in physical activities freely. Option D, give the patient detailed and complex tasks to complete. The correct answer is option B, provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. Question 9. In a patient with schizophrenia, which of the following symptoms would indicate a poor prognosis? Option A, auditory hallucinations. Option B, paranoia. Option C, flat affect. Option D, delusions of grandeur. The correct answer is option C, flat affect. A flat affect, characterized by a lack of emotional expression, is often linked to a poorer prognosis in schizophrenia. It can hinder social interactions and affect the individual's ability to engage in therapy or. Question 10. James is a 42-year-old patient with schizophrenia. He approaches you as you arrive for the day shift and anxiously reports, "Last night, demons came to my room and tried to rape me." Which response would be most therapeutic? Option A. There are no such things as demons. What you saw were hallucinations. Option B. It is not possible for anyone to enter your room at night. You are safe here. Option C. You seem very upset. Please tell me more about what you experienced last night. Option D. That must have been very frightening, but we'll check on you at night and you'll be safe. The correct answer is option C. You seem very upset. Please tell me more about what you experienced last night. Response C is the most therapeutic as it shows empathy and encourages the patient to express their feelings and share more about their experience. By actively listening and inviting the patient to talk, the nurse. Question 11. Substance abuse is often present in individuals diagnosed with bipolar disorder. Laura, a 28-year-old with a bipolar disorder diagnosis, chooses to drink alcohol instead of taking her prescribed medications. The nurse caring for this patient recognizes that Option A, anxiety may be present. Option B, alcohol ingestion is a form of self-medication. Option C, the patient is lacking a sufficient number of neurotransmitters. Option D, the patient is using alcohol as a coping mechanism. The correct answer is option B, alcohol ingestion is a form of self-medication. Individuals with bipolar disorder may turn to alcohol as a form of self-medication to cope with their symptoms. This behavior is often seen as an attempt to manage mood swings and alleviate distress. It is important. Question 12. The school nurse has been alerted to the fact that an 8-year-old boy routinely play acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of Option A, the need to dominate others. Option B, inventing traumatic events. Option C, a need to develop close relationships. Option D, a potential symptom of traumatization. The correct answer is option D, a potential symptom of traumatization. The behavior of an 8-year-old boy play acting as a police officer and locking up other children to the point of scaring them is likely a symptom of traumatization. Children may reenact traumatic experiences through. Question 13. The healthcare provider is providing medication education to a patient who has been prescribed lithium to stabilize mood. Which early signs and symptoms of toxicity should the healthcare provider stress to the patient? Select one that does not apply. Option A, increased attentiveness. Option B, getting up at night to urinate. Option C, improved vision. Option D, an upset stomach for no apparent reason. The correct answer is option C, improved vision. Lithium is a mood stabilizer commonly used for bipolar disorder, but it has a narrow therapeutic index, making early recognition of toxicity crucial. The correct answer is C, improved vision, because this is never. Question 14. What principle about patient-nurse communication should guide a nurse's fear of saying the wrong thing to a patient? Option A, patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. Option B, patients are more interested in conversing with you than in hearing your perspective, making offense unlikely. Option C, considering the patient's background, the likelihood of the comment causing harm is minimal. Option D, individuals with mental illness often possess a heightened capacity for forgiveness. The correct answer is option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. The correct answer is A. Patients value interactions with healthcare providers who express genuine acceptance, respect, and concern for their well-being. By focusing on conveying these qualities, a nurse can help. Question 15. Which chronic medical condition commonly triggers major depressive disorder? Option A, pain. Option B, hypertension. Option C, hypothyroidism. Option D, Crohn's disease. The correct answer is option A, pain. Chronic medical conditions can significantly impact mental health, often serving as triggers for major depressive disorder (MDD). The correct answer is a pain, as chronic pain is one of the most well-documented. Question 16. When explaining suicide precautions to a client, what would be the best explanation? Option A. You need to control yourself. If you cannot, we will do it for you. Option B. This can seem embarrassing, but we want you to be safe. Option C. You will stay on these precautions for 1 week. Option D. When you feel you are safer, then we will not need to observe you. The correct answer is option D. When you feel you are safer, then we will not need to observe you. Choice D provides a supportive and empowering explanation to the client on suicide precautions. It emphasizes the client's own sense of safety and control, indicating that the observation is temporary and can be. Question 17. Which statement is an example of reflection? Option A. I think this feeling will pass. Option B. So you are saying that life has no meaning. Option C. I'm not sure I understand what you mean. Option D. You look sad. The correct answer is option B. So you are saying that life has no meaning. Reflection is a communication technique where one person mirrors or restates the content or emotion expressed by another person to demonstrate understanding and encourage further exploration. The goal is to capture. Question 18. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states. Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations, acknowledging and supporting. Question 19. Which patient should be most carefully assessed for fluid and electrolyte imbalance among those receiving the following drugs? Option A. Lithium escalate. Option B. Clozapine, Clozaril. Option C. Diazepam, Valium. Option D. Amitriptyline. The correct answer is option A. Lithium escalate. Lithium escalate is the correct choice because it has a narrow therapeutic index and is excreted almost entirely by the kidneys, making patients highly susceptible to fluid and electrolyte imbalances. Lithium. Question 20. A patient with post-traumatic stress disorder, PTSD, is prescribed prazosin. The nurse understands that this medication is used to treat which symptom of PTSD? Option A. Flashbacks. Option B. Nightmares. Option C. Hypervigilance. Option D. Depression. The correct answer is option B. Nightmares. Prazosin is a medication often prescribed to manage nightmares in patients with PTSD. It works by blocking the action of adrenaline on specific receptors, which helps in reducing the intensity and frequency of. Question 21. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A. Limited language skills. Option B. Level of cognitive development. Option C. Level of emotional development. Option D. Parental denial that a problem exists. The correct answer is option D. Parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 22. Which statement demonstrates a well-structured attempt at limit setting? Option A. Hitting me when you are angry is unacceptable. Option B. I expect you to behave yourself during dinner. Option C. Come here, right now. Option D. Good boys don't bite. The correct answer is option A. Hitting me when you are angry is unacceptable. Choice A. Hitting me when you are angry is unacceptable demonstrates a well-structured attempt at limit setting because it clearly defines the unacceptable behavior without ambiguity. This statement sets a clear. Question 23. What should the nurse include in patient education for a patient starting on bupropion for major depressive disorder? Option A. Avoid consuming alcohol while taking this medication. Option B. Take the medication in the morning to prevent insomnia. Option C. It may cause significant weight gain. Option D. It is used as a first-line treatment for anxiety. The correct answer is option A. Avoid consuming alcohol while taking this medication. Patients prescribed bupropion should be educated to avoid consuming alcohol while on this medication to reduce the risk of seizures. Bupropion lowers the seizure threshold, and alcohol can further increase this risk. Question 24. Therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? Option A. Restating. Option B. Encouraging description of perception. Option C. Summarizing. Option D. Asking why questions. The correct answer is option D, asking why questions. Asking why questions is not considered a therapeutic technique in patient-centered communication, as it can make patients feel defensive or judged. Why questions may imply criticism or put the patient on the spot. Question 25. Natasha's husband died suddenly 2 months ago, and she has been overwhelmed with grief. When Natasha is subsequently diagnosed with major depressive disorder, her daughter, Nadia, makes which true statement? Option A. Depression often begins after a major loss. Losing dad was a major loss. Option B. Bereavement and depression are the same problem. Option C. Mourning is pathological and not normal behavior. Option D. Antidepressant medications will not help this type of depression. The correct answer is option A. Depression often begins after a major loss. Losing dad was a major loss. When individuals experience a significant loss, such as the death of a loved one, it can trigger major depressive disorder. This is because the intense grief and sadness associated with the loss can lead to the